I'm John Grant. I am a psychiatrist and researcher at the University of Chicago.
Hi, everybody. Thank you for watching this. I'm Sam Chamberlain. I'm Professor of Psychiatry at the University of Southampton in England, and I also work for the NHS, so the healthcare system in the UK.
I think the basic drive to write this book really came about as a way to give people information about sex, essentially. As a clinician, over the years, I have had so many of my patients who want to know about sexual functioning, sexual topics, and the only resource that I could find really for most people was the internet. But unfortunately, there is a lot of great information on the internet and a lot of misinformation. And so Dr. Chamberlain and I had discussed, well, could we put in a fairly concise manner, not trying to cover everything in the entire world about sex, but at least the main topics that the majority of people were interested in. And could we put it all in a simple, easy to read format based in science, so that it wasn't just our opinions about things, but actually things that had been researched by others, and sort of group all of that information in a very accessible fashion for folks, so that for people who have these questions and don't want to ask their clinicians, or those who do but have more questions than the clinician has time for, we're hoping that this can be a valuable resource, at least as a starting point for people to have these discussions. We know, again, it's not, it doesn't answer every nuanced issue about every topic, but the big picture approach we thought would be helpful for people.
Well, I think that's quite a complicated question to answer, but one of the big reasons I think is really historical, that in older cultures, there was a lot of stigma around sex. It was often viewed as something that shouldn't be talked about. It was even sinful. Yet, of course, we're all here, right? So clearly people were having sex, and the population of the planet is massive. So it didn't work trying to prohibit in that sense, but what it did mean is that people felt uncomfortable talking about it. Now, if we bring that into the modern era, of course, many bits of the planet, people are perhaps a bit more open in many ways, but there's still a lot of taboo around sex. And I think that's partly because of an intergenerational problem, that parents, often their parents, never felt comfortable talking about it. So those parents in turn find hard to talk to their children. And then that goes through the generations that no one really feels comfortable talking about it. Now, we have noticed, of course, these days that parents increasingly do want to speak with their children about aspects to do with sex. But then to some of the issues that John was talking about in the earlier question, people don't know. So if they've never learned about the science behind it, then how can they speak with their children? They might not feel comfortable talking about it if they don't themselves feel that they know enough about the topic, and it's hard to know where to look, right? So you go on the internet, some of that might be true, some of it not, a lot of it's not based in the sciences. I think a related problem, again linked to generations, is education. So a lot of schools now, of course, in a very positive way, try to teach about sex in an age-appropriate fashion, but the people giving that teaching might not feel comfortable teaching about it, may not know much about it for similar reasons, right? They've never had the opportunity to learn. So this is, some of the reasons behind why it's still such a taboo thing. The other thing to mention, of course, is sex is such a vast topic, and people can think, well, is what I do normal? So this concern that you might be judged by other people means it can be very hard to talk about as well. And the fact that the topic is so huge makes that more of a challenge for people. Well, I think the first thing to say here is that much like the effects of the pandemic on mental health, for example, it really depends on the person and the context. So we have to be a little bit careful about generalizing. That being said, there are some common patterns that we know from the research. We know during the pandemic, including the lockdown bits of the pandemic, that rates of sex went down, people were having less casual sex. We know that rates of sexually transmitted disease seem to go down as well. But these are averages. I think that people, when they were faced with such a high degree of stress, be that people getting ill, not being able to work, so kind of financial pressures, being stuck at home, maybe in quite relatively small environments compared to being able to go out into the world, then all of these elements of stress mean people are less likely to want to have sex. So perhaps some of those earlier findings I described, aren't that surprising. That being said, some people through the pandemic have found perhaps it's brought them together more closely with their partner. They've learned they had more in common than they realized, or perhaps learn to appreciate each other's time more. So for some people, their sex lives improved. The other thing that we noticed in the research is that people tended to turn to technology a lot more during the pandemic. Of course, if people can't physically interact, a lot of people were turning to online dating and sex apps, for example, or even other things like just as a way of communicating, getting to meet people. So they're kind of broader aspects of sexuality. A lot of people were engaging more with that over the internet.
I think that what we're seeing from scientific research, as well as from a sort of global interest, is more interest from the LGBTQ community in terms of how sexual topics that pertain to that community also fit within the larger frame. So I think that a chapter on these more diverse aspects of sex and sexuality were terribly important to present as its own chapter. Having said that, I would say that I really think that all these chapters, and including that one, and maybe that one in particular, would benefit from volumes of their own books, right? I mean, and this is one of the issues when one is trying to sort of make something concise and condensed, that perhaps you feel that maybe you're giving too much attention or not enough attention. So I would say that I think that we, again, touch on the tip of the iceberg, even in that chapter. But I think it's very important for both people of the LGBTQ community, as well as those who are not as part of that community, to sort of recognize the whole panoply of sexuality and sexual desire across all different types of folks and different subcultural and cultural differences. And so I think of it sort of as I hope, a respectful nod to this area of diversity. But again, we're not fooling ourselves in thinking that we, again, have covered it conclusively. So.
When we wrote this book, we really tried to think about, things about sex we want to know the answers to, but perhaps didn't feel comfortable asking or wouldn't know where to look. So by us, I mean everybody, right? So a sort of one-stop resource that would be helpful to people as a starting point. In terms of who therefore would be useful for, then really we were writing, with the general public in mind. We just think that everyone should be perhaps more aware about diverse aspects of sex and the latest scientific evidence. So we really wanted to bring together, basically do a lot of the reading for people about the latest scientific literature on aspects of sex, bring it all together in a readable, concise way. I suppose the other kinds of people that might find it helpful would be educators. So people involved in teaching other people about sex, for example, teachers or college lecturers, for example, people in these areas of research. Also, healthcare professionals, because we know that a lot of people might present to their healthcare professionals and may have, for example, let's say some difficulties around sex. Certain physical health conditions and mental health conditions can affect sex, of course, but often healthcare professionals don't feel comfortable asking about it. And this means that often our patients aren't asking about it and don't get the help that they need. So that's another sort of area that where people might find it useful.
I would say I hope it is a sort of an interesting and informative starting point to have people be aware of and get information about sexual desire, sexuality, and just human psychology in this area.